Hello, my name is Julie Boyce with United States University, FNP 596, Professor Stosner. Today I'm going to be speaking to you about iron deficiency anemia. In order to understand iron deficiency anemia, we have to have some basic teaching or understanding. Iron deficiency anemia is known as the most severe form of iron deficiency, classified as a shortage of iron, which leads to underproduction of iron containing compounds, including hemoglobin. RBCs, which we know as red blood cells, are the most function of iron in the body. Pathogenesis explains that iron serves a number of vital functions. I list a few, such as carries oxygen to tissues from the lungs in the form of hemoglobin, facilitates oxygen use and storage in the muscles, acts as a transport medium. And what I found out as I've been nursing over the past few years, that oxygen is very important. When a person comes in with a low oxygen count, sometimes they're confused. Their CO2 may be elevated. So if they're coming in with iron anemia, iron deficiency anemia, not only are they not getting enough oxygen, they can start developing tissue death. I've seen people come in with gangrene. I've also seen people come in with blood clots. If a blood clot is in that area, there's no blood flowing, then eventually the tissue will start to die and there'll be in a lot of pain. So understanding how iron is used in the body is beneficial, knowing that it carries oxygen to our muscles, to our cells, in our blood vessels, to give us not only oxygen but also give us energy, which I would mention that later on in the PowerPoint. The most common nutritional deficit among infants is iron deficiency anemia. In the U.S., nearly 15% of households lack the funds for a healthy diet. Toddlers ages 9 months to 18 months are at highest risk. Adolescent males are at risk due to the increased mass muscle and expanding blood volume. Most of our young men hit a growth spurt while they're in high school, and so they're saying they're at risk for developing iron deficiency anemia. Adolescent females and women of childbearing age, menstruation, and inadequate dietary, these type of people are also at high risk. And as you can see, it just doesn't affect just one type of person. It affects infants, toddlers, adolescents, and also it affects the elderly population and adults. And I will mention more of that as we go along in the PowerPoint. Due to the rapid growth of the adolescents, and then they don't. A lot of times they're on the go. They want something fast. They don't really want to sit down and eat. And I know females, when they're going through this stage, they already have a problem at times with their body. So sometimes they may skip meals. And then when they do eat, they may not eat anything that's healthy. I know I had a cousin one time, all she wanted to eat was French fries. Also, during the infants month, when they're infants, we have to make sure that they're getting nutrients to help with preventing iron deficiency. What are these people going to look like when they come into the office or when we see them? And it's going to depend on the severity and age. as you can see, I did list an age-related variation in hemoglobin level and MCV, and it just depends on where you get your information. This may change just a little bit. I think I found one that said diagnosis of anemia 3 to 6 months is less than 8, or so. That changed. This right here looked like it came out in at the bottom like 2010. However, on the left it's going to show microcytic and hyperchromic red blood cells, and they said this is not usually seen in pregnant women to diagnose them of anemia, and it's probably due to them carrying the baby and having to produce more oxygen. Infants and toddlers, hemoglobin, like I said, less than 8. They also going to be they're going to present with irritability and restless. And pica is common at all ages, and that's craving non-food items such as dirt, paper, and ice. I have a niece who says that all she wants to do is eat ice, and I told her that she needed to start doing a supplement because it sounded like her irons were low, and she said that she had to do that when she was pregnant with her daughter. So if you have a person that come in that often say, all I crave is ice, then that can be a sign for iron deficiency anemia. What can cause iron deficiency anemia in a healthy person? We have people that come into the office. Since I've been in clinical, I had a lady to come into the office, and she said that I have no energy. No matter what I do, I just cannot get enough energy. That pretty much was her only complaint. My preceptor did ask her, was she craving any foods, and she said no. But when you look at her eyes, you can tell that her eyes were pale. And so after they drew her blood and called her the next day and told her to go to the hospital because her hemoglobin was 6. So what can cause this? In adolescents, we already mentioned that a rapid growth, and then before the age of 24 months, they're also growing pretty fast. Food insecurity. We have to make sure that our patients are able to afford food. Sometimes they may not tell us the whole truth, and sometimes they may. Introduction of cow's milk, a post-gastrectomy, such in our bariatric patients who decide they want to have the bariatric surgery. We want to make sure that their blood counts are up. Unrelenting diarrhea, and also vegetarians, food fetish, or a person with an eating disorder. A lot of people are going vegetarians, doing vegetarian diets. So we want to make sure if they're raising their kids on the same type of diet, that they are aware of iron-enriched foods and explain to them how to go by getting enough iron and nutrition into their children. And I found this picture at the right upper corner. It shows 62.4% food secure, and mild food insecure, and moderate food insecure, and severely food insecure. So hopefully we are able now to provide more nutrients to families, and so they can have a healthy lifestyle. Diagnose and evaluation. First, we want to make sure that if a person comes in complaining of symptoms, that we evaluate the onset and duration of the symptoms, of course. We always want to do a physical assessment, history and physical. Make sure that we understand, make sure that we rule out bleeding, dark tarry stools, any gastrointestinal complications. Ask about the children, what type of milk are they drinking. Also, you want to make sure that you, on the pediatric patients who are at risk for lead exposure, or lead poisoning, we want to make sure that we testing them for lead. Monitoring them for coughing and vomiting of blood, and those can be our patients that have cancer, lung cancer, leukemia. We want to make sure that we're monitoring them for abnormal bleeding. A thorough diet intake of foods intakes in all population with this illness, because sometimes they may think that they're eating the right type of foods and they may not be. And then if you look down, I did mention some diseases that increases risk of iron deficiency anemia, such as peptic ulcer disease, gastritis, sickle cell. How many times have we had patients that come into a hospital in a sickle cell crisis and we have to give them 3 units of blood? I know I've had to do it many of times in my career, because we want to get that oxygen to their tissues, to their organs, so they don't go into an organ failure. Also, this is a continuation of diagnosis and evaluation. We want to do infant milestones, because this can cause delay in growth and cognitive behaviors. We want to make sure that we are doing a complete assessment, no shortcuts. My preceptor with the pediatrics, she is thorough. She has a routine down, and it does not matter how long she's been with another patient. If she has to go in another room and take care of another patient, she's taking her time. We want to assess the heart and lungs and height and weight. And as I mentioned before, we want to assess the eyes for pallor in our dark-skinned patients. If an adult comes in and they're complaining of anemia, they're showing signs of anemia, go ahead and do a stool coat. Sometimes they can say they haven't noticed any bleeding, and sometimes they can say, well, my stools were black, but I just thought it was something I ate. So it's good to just go ahead and check that when they come in with a low hemoglobin and hematocrit. Listen to the women of childbearing years. If they're saying, I'm having a lot of bleeding during my cycle, that I don't have the energy, draw the blood work, and if we have to, refer them to OBGYN for further testing. Postmenopausal women, you want to check them out, because cancers can cause anemia, and if they have some kind of cancer, we want to be able to pick up on that. Stool sample for children also, with diarrhea, send that out. Labs to be done, CBC, hematocrit, and as you can see, iron studies, and monitor their meds. In our elderly, because of arthritis, they may take NSAIDs, and we know how NSAIDs work on the intestines. They can cause erosion, and in turn, they can cause bleeding that can lead to anemia. Now, once these patients have been diagnosed, we have to come up with a treatment plan that's going to be appropriate for the patient. Mild to moderate, it says to give oral medications such as ferrous sulfate, which is widely used. It's easy absorption and inexpensive. Because, if patients can't afford food, prescribing high expensive medicines would just put a damper on them even more. If they have to get their food versus their medicine, I guarantee it's not going to be the medicine. Also, it says that this particular medicine is easily tolerated, well tolerated. But one of the side effects, as we know, of iron deficiency, of taking iron tablets or iron supplement, is constipation. So we do want to make sure that they understand if they start to have those symptoms to let us know. It also comes in an elixir for our younger population who cannot take pills. For severe, hospitalized, and blood transfusion may be required. Hospital, and I showed some pictures of some foods that need to be encouraged in pregnant females, and also in our patients who has the iron deficiency. We want enriched foods with iron. Let's see your meats, your beef, your fish, eggs. Just make sure they understand. Educate and provide information interventions. When you give a person iron tablets or the elixir for the little small ones, make sure they understand how to take it. My son had a friend where her daughter was put on iron drops, and they told her to give her 3 drops. So she was just putting 3 little drops in a bottle every day. And when she went back to the doctor, they were saying that she was being neglectful because she wasn't giving the patient the medicine. And she explained to them she was giving the medicine. And then finally someone said, well, how much are you giving her? And she said, I'll give her 3 drops. And they didn't explain to her that she needed to fill up the dropper to give her that. It was a big deal. DFACS was called, and that was a useless, stressful situation if the patient had understood fully. Instruct on lifestyle change for healthy living. Make sure they're eating the right types of food. Stop smoking, because that increases your chance of decreasing your oxygen for one, and also it increases your chance of developing cancer. Avoid NSAIDs if possible. Change the medication to something less irritating. Increase foods with iron, such as meat. And it says liver is not recommended due to high cholesterol. I didn't know that, but I'm glad I do now. I don't like liver anyways. But I remember as children, we were made to eat liver sometimes. Give vitamin C. In some situations, you may have to give vitamin C because it helps absorb the iron. And let them know that some foods inhibits the absorption. Sometimes we may have a pamphlet or something that we can print out. And children ages 1 through 5 should not consume more than 20 ounces of milk a day. And some people have children that's all they drink is milk. And they said the reason why is because once they have that much milk, too much milk, they don't want to eat. And milk is not fortified with iron, the cow's milk. In conclusion, we want to make sure that we are treating everyone for iron deficiency anemia. Know the signs and symptoms of all population. Sometimes we don't want to get comfortable. I don't want to get comfortable in thinking that it's just a complaint. We want to make sure that we listen to our patients. Refer children out if they are not responding to the medication. They need to see a hematologist. And even in the adult population, it may be a time that they may have to be sent out for for more evaluation with a specialist. Let the patients know they may start feeling better, and if they do start feeling better, just know they need to continue the medicines. And we're going to recheck them in 8 weeks, for 8 weeks, and then every 6 months to make sure that the levels are remaining normal as long as they're taking medicines. So this is the end of my PowerPoint. I hope you enjoyed it. Thank you for listening. These are my references. If you have any questions, you can contact me through the school email. Thank you.